Hello and welcome to your Advocacy and Community Pediatrics Rotation. I'm Dr. Dina Leeser and it's really a pleasure to oversee and work with you on this wonderful, exciting experience. During this time we have together, I'm going to give you a brief overview of the rotation itself, give you a brief introduction to community pediatrics and advocacy, and tell you what to expect in terms of your contribution to an advocacy project. So this rotation, which has started over a decade ago now, was begun when the ACGME came out with a statement mandating that all pediatric residency programs have a structured experience in community pediatrics or child advocacy. We were privileged enough at the Cornell residency program to have found a dedicated block of time during that second year residency. Since then, it has expanded to 2 to 3 3-week blocks of time during second year. And the experience itself is comprised of several aspects. The first aspect is sort of the didactic or curricular aspect, which includes sessions like we're having now, specific dedicated readings, and targeted goals and objectives for you to look over and achieve. The other aspect is what we call the service-based learning aspect, which consists in practicality of your site visits to a wide variety of carefully chosen sites with which we have nurtured relationships, each of which have specific goals and objectives for you to be thinking about and looking at while you're visiting them. Broadly, each experience is really aimed for you to gain a deeper understanding of the many social determinants of health, to gain a better understanding of both the reality for many children and family in our city and our country, as well as to conceptualize ways that you, as a pediatrician, can better contribute and link with a variety of community-based settings. So again, this is a very important part of the rotation. Paired with each opportunity that you have to go to a site visit, there are targeted objectives again for you and an opportunity for you to reflect upon these in your blog or journal entry as an opportunity for you to really synthesize and think about what impact this might have on your thinking as well as on your practice as well as your career decisions. The other aspect of the rotation is the project. The project has also evolved over time. So we found that residents were coming up with wonderful ideas, really innovative, important work they were doing, and just as soon as something wonderful was created or begun, the rotation came to a halt. And so this was frustrating that all this really good work didn't really permeate and penetrate and reach the children and families it was intended to. As a result of that, we started doing group projects. And so we have 3 projects that you all have the opportunity to choose one to contribute to. And so you'll have the opportunity to make a very concrete and distinguished contribution to a project on a particular level, as well as to have the comfort of knowing that it will be continued, that it will be sustained, that it will be disseminated. And we will also be sure to communicate with you moving forward so that you understand what's happening to the work, what's happening to the project in general, and of course, if you're so interested, that you'll have continued opportunities to actually continue to participate in the project. So again, a few words about the actual concept of advocacy and the rotation itself. And one really has to do with the incredible opportunity that you have as a physician to make a difference. And study after study shows that physicians are wonderfully trusted messengers for children and families. They have done many surveys of both elected officials and the public in general, and nobody comes out to higher than the local children's doctor in terms of children's issues themselves. And so that gives you an incredible opportunity as well as, you know, a responsibility to really contribute to what's happening for children and families. We also know that the root of children's health and well-being is so socially determined, and so issues of poverty, of exposure to different kinds of risk factors, whether it's a depressed mom, whether it's, you know, drug use in the family, whatever it is, so many, or lack of education, so many of the issues happen in what we call upstream, far before we see the manifestation of medical issues or challenges that we typically see in a clinic or emergency room. And so it's really been increasingly acknowledged that to be advocates or proponents or supporters of child's health, we need to delve deeper and address some of these social determinants upstream in order to have an impact on child's health. Some of the language around this through the AAP, for example, is called millennial morbidity. And so it's an acknowledged reality that social disarray, disorders of the bioenvironmental interface, including socioeconomic influences on health and health disparities, really are important areas that pediatricians need to be well versed in addressing. In fact, the AAP has a policy statement that clearly states that pediatricians need to prepare themselves now for their role in the community as diligently as they do for their traditional clinical role. And so what does this look like, and, why, again, is so important? Some of the realities is that the ACGME says, yes, we need to have an experience around this because it is so important. Again, the AAP comes out and says it. It really is a win-win situation because it allows you to impact child's health and well-being. It gives children and families that important start and support that they need. And there are also a lot of different regulatory bodies, issues around the medical home and certification that really align nicely so that as you engage more in advocacy and community pediatrics, you will be able to promote yourself in your career in many exciting ways. The actual definition of advocacy is active support of an idea or a cause, especially the act of pleading or arguing for something. Protagonism, support, drumbeat, urging, those are all synonyms that are discussed around advocacy. Community pediatrics, the AAP definition, is a perspective that enlarges the pediatrician's focus from one child to all children in the community. A recognition that family, educational, social, cultural, spiritual, economic, environmental, and political forces act favorably or unfavorably, but always significantly on the health and functioning of children, and a commitment to use a community's resources in collaboration with other professionals, and really that it's an integral part of the professional role and duty of a pediatrician, and a synthesis of clinical practice and public health principles directed toward providing health and care to a given child. So again, that's a pretty detailed definition. For the purposes of our work together during this rotation, we're going to define advocacy and community pediatrics as a spectrum of activities on the clinical, community, professional, and policy level that ensure and promote the well-being of children. In fact, what I found in a lot of the work that I do is that there is sometimes a gray line or a fine line in terms of how people use the terms community peds versus advocacy. And so while they each do have distinct definitions, they're used sometimes interchangeably. And so we're very excited to offer you this framework to think about this. And the framework that we like to use is one that's been supported and discussed in a lot of AAP literature and other literature, and that's to look at advocacy or community pediatrics on several levels. One, the clinical level, two, the community level, and three, the policy level. And so what are these actual levels? And what does this mean in terms of your rotation and your learning and all of that? And so advocacy on the community level is something that you are all engaged in all the time, whether or not you're calling it that. And so this is the opportunity that you have to impact children and families as they interface in your clinical encounter. And so this has to do with what information you support them with, what services you provide, what linkages with the community you make for them on their behalf, what is the scope of topics that you address. What's the matter?